Hi, my name is Ardell Frick, and I'd like to share with you my thoughts about nursing as a profession and healthcare in general. I'd like to put that into context of my experience as a nurse. And when I was a high school student, I was on an exchange program, and I had the opportunity to go to the Soviet Union, what was then the former Soviet Union. And I got sick and had emergency surgery there. Here's a picture of me as a very scared 16-year-old in my hospital bed. And no one spoke English, no one spoke French. The school group left, and I was there with one teacher who had restricted visitation. And yet the kindness of some people who tried to help me really made me understand how important caring is. That's when I decided to become a nurse. So I came back to Portland, started working as a candy striper in the hospital. And then a year later, I graduated from high school and started into my diploma program when nurses still had to wear caps and white nylons and white dresses. It really became quickly apparent to me that my diploma program wasn't going to be satisfactory for the kind of career that I wanted. And I was very fortunate that the University of Portland had an alternative entry program. So I was in their second or one of the early classes and got my baccalaureate degree. I had several really formative experiences early on in my career. The first one was working in dialysis, learning about how patients have to live with chronic illnesses and the ethics involved in a very costly treatment and what happened when patients weren't always adherent to their treatment regimes. The second really formative event was doing medical record review as a legal nurse consultant for potentially compensable events and professional liability, just delving deep into the kind of events that harm patients in hospitals. And the third and final, probably most formative event in my career was working directly for a health plan and understanding the financial aspect of resources and how they're allocated and restricted from patient care and the impact on those decisions. So the things that I believe about nursing, first and foremost, I believe that the baccalaureate degree should be an entry into practice. We should standardize our education. This was first called for in 1964, which is 54 years ago. We still haven't been able to kind of come to terms with that, and I believe we owe that to students and consumers to standardize our practices. I believe it's a sacred privilege to enter into a caring relationship with a patient, and we're guests in their lives, and I have tried to never lose that perspective. I think patients have a right to information. They have a right to be participants in their care. The next generation of consumers is really computer savvy, and they come with printouts on their medications and their procedures, and I think that's going to change our relationship as it's a partnership and a dialogue more so than maybe it's ever been. I think we have a right that capable adults have a right to refuse care. They have a right to make poor decisions about care, but I also believe that they also then have a responsibility for their decisions and not necessarily to receive unlimited resources related to their choices. I think that we as a profession need to have an unrelenting focus on patient safety, and we need to make sure we have a seat at the table when decisions are being made, when best practices are being evaluated, and bring that knowledge and practices and skills and just worldview into education so that we do everything possible to prevent harm. I believe that there's going to be drastic changes in healthcare delivery in the very near future, and nurses need to be partners in the decision-making, in the forward-looking thoughts as we move into cell phone apps and remote monitoring. We need to know how that's going to impact our practice and who's providing the care. We need to be really robust partners in the healthcare delivery cost problems and make sure that we're knowing that we're participants and we're knowing what kinds of decisions are being made as patient care costs must be driven down, and we have a tension between the desire to be compensated fairly as professionals and then the costs of care, which are becoming unaffordable. So we need to be involved in that and see what it means for us as a profession. I have been incredibly blessed to be a nurse. It's been an amazing journey with all kinds of different care venues. I've been super lucky to just keep growing and changing and learning, and I don't know if any other profession that I could have been involved in that I've had as many amazing experiences and thousands of patients who allowed me to participate in their lives. So I'm super excited to see the new opportunities I'll have with a master's degree, and I really thank you for listening to my thoughts.